There are 4 VA disability ratings for ischemic heart disease. You have 10%, 30%, 60%, and 100%. For several years, the VA has acknowledged that veterans who served in Vietnam between 62 and 1975 were likely exposed to tactical herbicides such as Agent Orange. The U.S. Department of Veterans Affairs mandates that any veteran that served in Vietnam are presumed to have Agent Orange exposure. So if you're in a certain place, certain time frame, the ones they actually acknowledge, then this would be considered a presumptive condition. So the lane that you would want to choose is presumptive service connection. You have direct, secondary, pre-existing, presumptive, 1151 claims. So this is presumptive service connection. What is ischemic heart disease? Ischemic heart disease involves a reduction of blood flow and oxygen to the heart, which results in the heart muscle not getting enough blood and oxygen. Usually there's a buildup of cholesterol and other substances called plaque in the arteries that bring oxygenated blood to the heart muscle. Over time, ischemic heart disease damages and weakens the heart muscle, making it very difficult for the heart to fill and pump blood to the rest of the body. If you already have this, you probably already have a diagnosis, so you're familiar with, how this feels and what it actually is based on what your doctors have explained to you. If not, if you don't have a diagnosis yet, you're going to need one because that is one of the criteria you need to establish service connection for ischemic heart disease. You need to have a current diagnosis. You need to have current symptoms. The symptoms is where the rating's going to come from, 10, 30, 60, or 100. And then the nexus in this case is going to be the fact that you are in a certain place like Vietnam and you're exposed to Agent Orange and you have the diagnosis for ischemic heart disease. So that's basically how this one will fit together. One thing to note is, how is this going to fit into your overall ratings? This is where the strategy comes in. If you want to talk strategy, check out my boot camp, combatcraig.com, links in the description. Common symptoms of ischemic heart disease: chest pain behind the breastbone or slightly to the left of it, dizziness or lightheadedness, the feeling of indigestion or heartburn, nausea, vomiting, or cold sweats, a sensation of feeling the heartbeat, shortness of breath, unexplained tiredness after activity, coughing that results in severe chest pain. So wide-ranging symptoms. And if you don't have a diagnosis for this yet, get to the doctor, because obviously you need to have a doctor diagnose you. You're going to have to get your doctor to nail this down, diagnose you with ischemic heart disease, attribute the symptoms that you have to ischemic heart disease. I would have him make sure the symptoms are right so you get that 60% rating or that 100% rating if that's what you're trying to do. And I would also, ask the doctor to write the nexus for you. I was in Vietnam. I have Agent Orange exposure. I have a diagnosis for this is killing me, whatever you have. And now this is another thing. Do you think, or can you put in a medical opinion that my ischemic heart disease, along with my diabetes and my other weird cancers that I have, is likely caused by my Agent Orange exposure? You don't need the nexus, but while you're talking to your doctor, might as well get a nexus. Remember, you're filing a VA claim. They're going to send you to a C&P examiner. He might not see it that way. They get paid by the VA. And then more importantly, the VA rater makes the decision. So this guy is not a lawyer and they're not a doctor. And as they may know a lot about medical and legal conditions, like I do, they don't know all of them. So if you have a doctor, really lay it out in a nice little bow for them. It's not going to hurt you if you come up with a nexus. Not all heart diseases qualify for the presumption. Just because a veteran has not explicitly been diagnosed with ischemic heart disease does not mean that he does not have the condition. Ischemic heart disease includes coronary artery disease, coronary heart disease, ischemic cardiomyopathy, and myocardial ischemia. So it could be one of these things. There's a lot in the ischemic heart disease bucket. The veteran may or not have the initial symptoms listed above, and Vietnam-era veterans with heart disease should ask their doctors if the particular diagnosis is a form of ischemic heart disease. So when we're looking at ratings and things of that nature, we're looking for codes, how the VA is going to rate them. Ischemic heart disease is a bucket, and you could have something in there that's not called ischemic heart disease. You might have something that's called ischemic cardiomyopathy, and that is rated and is a form of ischemic heart disease. So you really need to get in and figure out what you have and make sure you prove it. The VA has listed the following cardiac conditions as falling within the definition of ischemic heart disease. This is a wide range. This is a big bucket. So if you're in here and you're diagnosed for one of these conditions, get your doctor to be as specific as possible. Again, always better to have him point to what this is. This is what you have. It's AKA ischemic heart disease. It's good for the VA rater to see that. And if he could create the nexus, of course, it's because you are, bathing in Agent Orange. Any idiot knows that. If he could write something like that down for the VA rater, again, that's going to help you. If the doctor says the condition does not count as ischemic heart disease, of course, the doctor needs to state that in writing and with medical rationale. If the doctor says that the condition does not count, a second opinion may be in order for several reasons. One of them is to get it service connected. So since it has to do with the heart, and there's so many things in this bucket, you may go to a VA doctor or any doctor, whatever doctor, and they just might not see it the way that you see it. So getting a second opinion is a great idea. We're trying to get paid here, so you need the doctor to actually give you the right diagnosis. And if you have a doctor that's not on board, go get yourself another doctor, get a second opinion, get a third opinion. It's not that hard, just some doctors aren't going to see it the way you see it. That's fine. Moving on to the next doctor. How does the VA award disability ratings for ischemic heart disease? Once it's verified that the veteran has been exposed to Agent Orange, that's you, right? The veteran has a valid diagnosis of ischemic heart disease. We got to the right doctor. Took 2 or 3 of them, but we got the diagnosis now. The next step is to determine what the rating for ischemic heart disease is going to be. The proper rating is determined by looking at several factors per the VA schedule for ratings for the cardiovascular system, 38 CFR 4.104. Here's the rating criteria for ischemic heart disease. 100% rating. The veteran consistently experiences congestive heart failure, receives 3 METs or less, and he is short of breath, fatigued, and experiences chest pain, dizziness, and/or fainting. Shows left ventricular dysfunction, and the percentage of blood pumped out with each heartbeat is less than 30%. A 60% rating. 2 or more episodes of congestive heart failure during the past year. A score of 4 or 5 METs, and he is short of breath, fatigued, and experiences chest pain, dizziness, and/or fainting. Shows left ventricular dysfunction, and the percentage of blood pumped out with each heartbeat is between 30 and 50%. So as the ratings are higher, obviously there's more problems. So 100% is 3 METs. 60% is 4 or 5 METs. A 30% rating for ischemic heart disease, a score of 6 or 7 METs, and he is short of breath, fatigued, or experiences chest pain, dizziness, and/or fainting. An X-ray or electrocardiogram shows evidence of hypertrophy or dilation. So it's a little bit different as you go down to the 30% rating. A 10% rating is given if a veteran has a score of 8, 9, or 10 METs, short of breath, fatigued, and experiences chest pain, dizziness, and/or fainting, and requires continuous medication. So you have to figure out to get the 10, 30, 60, or 100% rating. If you're already rated for it, you should look at this criteria, and if your symptoms have changed and you deserve a higher rating, and you have that on paper and you have it logged, most likely, right? That most of these tests are objective. All these tests are objective. The doctor's opinion can vary, but objective tests, you either have it or you don't. So if you have a 10% rating for ischemic heart disease and you deserve a 100% rating or a 60% rating because things have gotten worse in the last 10 years, you should file for an increase. How does the VA diagnose heart disease? You're probably going to get an electrocardiogram of ischemic heart disease. Another factor the VA will consider outside the symptoms the veterans is experiencing is any heart surgery. So if you have your symptoms and then have you had any heart surgeries, VA will look at whether you've had any procedures which might qualify you for a higher rating, even if it's a temporary rating. If you're taken out completely, they'll give you a temporary 100% rating for 4 months. That's how the temporary 100% ratings work. VA will assign 100% for procedures such as heart valve replacement, coronary bypass surgery, cardiac transplant surgery, or implantation of a pacemaker. So if you have these 4 conditions, these are 100% criteria. What are some other ways to go? You may get stuck. Your numbers may be your numbers, but that's the way they are under the law. But you have depression because of this, the stress that you've been under, since you had this and probably multiple other Agent Orange conditions. And you're like, how am I not 100%? Like I qualify all over the board. Yeah, except for you're using the combined ratings table. So if you're a Vietnam veteran, you're obviously in your late 60s, 70s. You're not working anymore. You're retired. You may not have worked for years anyway. One route you could go is TDIU, total disability based on individual unemployability. There's criteria for that. Check out the box right here for my video about TDIU. I have a whole playlist there. And TDIU might be a way for you to go. Get a vocational expert involved. They are game changers in TDIU claims. It all comes down to strategy. Make sure you have one and make sure you fit everything together. You're going to need your VA claims file. You need to review your past decision letters. What have you been saying to the VA? And more importantly, what have they been writing down about you? What you said. It's literally in quotes. They've quoted me hundreds of times. So get your VA claims file, review the information, get your rating code sheet, see exactly what you have, add it all up and see, where are you trying to go? Are you trying to get a 100% rating? If that's so, great. Are you at 87%? Rounded up to 90. Are you 93%? Rounded down to 90. Good information to know because it makes a big difference. If you're at 93%, you need one more 20% rating. If you're at 87%, you need one more 60% rating, 70% rating. Check out the sponsor of today's video, Hill and Potton. Check them out. Links in the description at hillandpotton.com. And if you were at Camp Lejeune, I have a link for you as well. The Camp Lejeune lawsuit is part of the PACT Act that rolled out a few months ago, and they're actually starting to adjudicate those claims. Don't forget to sign up for my boot camp if you want to learn more about my process, which is the VA claims process. You're going to need medical evidence to win your VA claim. If you're missing a diagnosis, severity of your symptoms, or a nexus, and your doctor won't do it for you, send an email to Second Strata and see if they can help you with your missing medical evidence. YouTube is recommending this video right here because it's relevant to VA claims, and you'll probably get some useful information out of it, and I'll see you in the next video.